Hi, this is Brian Salyer going over the application of process module, and I'm going to be talking through the oral section, which is the interview based on the benefits card. Now, I did my interview with a man named Marcus Thompson. He was a project manager and is in the administration staff for Piedmont Health System, which is a regional hospital network, sort of floating around the Middle Georgia area, specifically in Atlanta. Um, Now, the name of the project was rather straightforward. It was the Patient Flow Optimization Initiative. And its original goals, he said there were three original goals, to reduce the average emergency department wait times from 87 minutes to under 45 minutes, to decrease the patient boarding, which is patients waiting in the emergency department for an inpatient bed, by 40%, and to improve overall patient satisfaction by 20% within 1 year of implementing the program. Now, he said that the purpose for this whole project was basically to address chronic overcrowding in the emergency department. This was leading to patient safety risks, staff burnout due to just high stress environment, and negative perception and press coverage around the hospital. So that was kind of like the foundation of it, right? And this all sort of stemmed, he said, from an internal audit which revealed that the hospital was losing almost $2.3 million annually, due to patients leaving without even being seen, maybe moving to another hospital, and that their satisfaction score had dropped for 2 years in a row. He did say that he couldn't provide me with the specific years that this occurred. He said that that was confidential information. Um, Now, as for people involved in the project, um, there was the COO, who at the time was Dr. Linda Ferris. He himself was the project manager, and his core team. Again, he said that the actual names of the team members was confidential, but it was a select group of three emergency department nursing leads, a rotating crew from the IT department, the management and the admissions staff, two hospital physicians, and then as well a contracted lean process consulting firm, which he said the firm's entire deal is to help hospitals specifically to cut down on wait times. Um, this whole project was given 18 months. There was an $850,000 budget for any implementations that they wanted to add, and they were not allowed to disrupt any ongoing procedures or patient routines, right? So they couldn't stop hospital functions to implement anything that they came up with. Um, Now, three benefits that they ended up coming out of. Well, before I get into that, I want to talk more about the creation element. Um, so, what did they actually want to create? They wanted to redesign patient triage and bed assignment workflow. What that means is they wanted to create a real-time bed tracking dashboard, which would be a software, and then have updated staff scheduling models based on AI algorithms to optimize, coupling different people with different skill sets, and then as well to implement a training program for all emergency department personnel, just to sort of freshen up and go over their new procedures. Um, they had a couple milestones that they were trying to reach. By month three, they wanted to create a workflow design plan. By month seven, they wanted to implement the actual software. Month 10, they wanted to have the full staff trained through that new training program. And then by month 18, which is 6 months after this whole program had been launched, they needed to evaluate it and then they would dismiss the team. So now as for the benefits of the program, He gave me four, but I'll go through the three top benefits, right? So first, reduce patient wait times. This was successful. Patients, he said, spent significantly less time waiting in the emergency department before being seen by a provider. Um, a patient arriving with chest pain may be seen by a physician in as little as 18 minutes compared to the previous average with chest pain cases, which was 52 minutes. Um, this was measured by so in order to ensure that this program had actually been affected, they measured this by going door to door, checking checking with physicians, as well as using the new software, which was the bed tracking dashboard. And all of this resulted in average wait times of 21 minutes, going up to 50, but still much better than the previous 82 that he had said the hospital was averaging. Um, improve staff satisfaction and reduce burnout. He said that was the second benefit. He said that nursing and physician staff reported lower stress levels and felt better due to being more supported with clearer workflows, clearer operations, and reduced overcrowding. And he saw this through emergency department nurses who reported in post-implementation surveys that they ran that they felt better able to spend quality time with each patient rather than spending most of their time just managing chaos. He was able to check this benefit through staff satisfaction scores in surveys, which was a tool that they optimized throughout this program, an HR tool that had previously been there, but they optimized it here. Nursing turnover dropped from 22% down to 14% in the emergency department within 1 year. Now, the last benefit that I want to go over, because I think this is probably the most important, is enhanced patient safety. Faster triage and reduced boarding meant high acuity patients received timely interventions, reducing adverse events. That's a very fancy way of saying that people with high risk symptoms were able to be seen quicker, and people with medium risk symptoms were able to be seen quicker because they weren't just responding to the most deadly sort of illnesses and injuries coming into the hospital. This was measured for an example that he gave. A code blue event was identified and responded to 4 minutes faster on average during the post-implementation period compared to the prior year. He described a code blue event as somebody coming in with a mild to severe life-threatening injury. Um, and then another way that they measured it was adverse event reports. These come in monthly at this hospital. And he said these basically go over sort of the bad parts of the job, things that didn't go well in the emergency department. He said response time to critical cases, patient safety, incident rate, and all of that was being tracked throughout these adverse event reports. He said overall there were improvements. There were not as many critical cases. Patients were not having as high of an incident rate, and they were overall reporting higher satisfaction in that sense. Um, Now, overall, I think interviewing this particular project manager was a little overwhelming, um, specifically just because I don't know anything about hospitals. So as we were kind of going through the interview, he was having to explain many different parts of it to me. So that was definitely overwhelming. But I think I got a better understanding of the benefits card. He liked the way that it was laid out. He liked the idea of sort of breaking out the benefits of a project and seeing them so itemized. He said he hadn't really done that kind of thing before at any sort of interviews about the project. And I mean, overall, I had a good experience doing this. I had a good experience using the benefits card as well as the material provided throughout this module to sort of shape my interview and kind of the questions that I was going to ask. I think you'll see very similar questions being asked in my professional interview that I'll be doing for the final project. Doing this first certainly set me up better for that. And so, yeah, overall, I was pretty satisfied with how this turned out. But yeah, that's about it. Thanks.